So before Paul, this is a year follow FUE. Paul gonna share his experience with 2,289 graph. And before we do that, I'm gonna show the audience what he looked like before, real quick, and then Paul will go over his experience a year later. And then again, hair transplant is an art form. Require a lot of the artistic and aesthetic detail. And that's why I have clients who flew in from England, France, and Australia, and Asia, and Africa, of course. And people don't fly for price. They want to make sure they have the most natural hairline. So, okay, Paul, go ahead, start.
Yeah, so, you know, hair loss was something that you don't think you're going to deal with when you're young. And when I think I started to notice that my hair was receding probably in my early 20s, mid-20s, 22, 23, and always had kind of a high hairline. And I think by the time I was 24, I was like, wow, I'm losing some hair here. And you try to style it different ways and keep it long. And, you know, I think from a confidence standpoint, I was lacking confidence and, you know, doing just regular activities, going to the pool, going in the ocean or anything like that. You don't want to because it's going to expose, you know, the openness of your hair. And just really difficult, and I think again at a young age to have to deal with that. And so that was upsetting and troubling, but I was able to, you know, for a while kind of makeshift my hair so it was styled a certain way, but ultimately I just wasn't happy with it, and I didn't like taking pictures and again going in the water and doing certain activities. I'd wear a lot of hats. So I just at any turn, you know, I'd be playing with my hair a lot thinking it needed to look perfect, and you know, wasted a lot of time and tried every hair product, and it wasn't the products, it was the lack of hair. So it was stressful, it was difficult dealing with hair loss from that aspect. So after a couple of years dealing with it, I, you know, started to look into, you know, hair transplants and are they viable, and, you know, how much money, and you know, do they actually work? And through some research, was lucky enough to find Dr. Diep here, and I'm local to the area, which was a help, but I looked at some other doctors, and, you know, I hesitated at first, and then finally realized, you know, I'm not getting any younger, this condition isn't going to reverse itself, and there's nothing I can do. And, you know, finally came in and just immediately felt like Dr. Diep was truthful and honest with me, and very forthright and forthcoming about what, you know, I needed to do and what we needed to do, and, you know, the results that we'd have, and just realistic and setting expectations as well. So I kind of felt like we had a connection, if you will, there, and ultimately entrusted him to, you know, to do this hair transplant, which I think looks great. So, you know, I think just overall it's very trustful of Dr. Diep, and just felt like he was very honest and kind. So that, you know, was certainly a help. And, you know, was able to get in here pretty quick too, being local. There was a cancellation, and I think originally it was going to be 2-3 months between. I was able to get in.
6 months now.
Yeah.
6 months waiting list.
Yeah,
now.
it was 6 months waiting list, something like that. And I was able to get in, I think, in 2 months, which was great. Not sure that helps everyone, but so finally come in on surgery day, and I think, you know, the weeks and days leading up to that, you're really nervous, you're apprehensive, just thinking about it every day, anxious just to get it done and how it's going to look and get through that. And surgery day couldn't have been anything other than comfortable and just an overall positive experience. I came in early and met the doctor, and, you know, half a day later, basically, I guess I was out and feeling great, and you know, didn't feel much pain even from the FUE. You know, I knew that there was some stitches back there, and but the doctor and his team was just fantastic in working with me, and made the surgery day a very pleasant and positive experience. So, you know, get home from that, and the healing up process was interesting in a good way. Couple days in, I felt like there was some, you know, through the washes, some, I guess, like scabbing in the area, which is normal, but looked like there was some yellow, I guess, pus buildup, if you will. So on a Sunday, I emailed the doctor, and
you actually texted me.
Yeah, I texted you. Yeah, and he responded to me right away, at like within minutes and got me medicine that day and was able to see me the next day. So, you know, I was really thankful, even being local, but you always wonder or worry, you know, are you going to come in and you're just a patient and you're out the door as a number. And he couldn't have been any more responsive and thorough in, you know, talking to me that day and seeing me the next day, and, you know, address the issue, and was able to obviously not have any ill effects from, you know, potential bacteria issue or infection up on the surgical site. So that was fantastic. And, you know, from there, just kind of let the healing process set in. And fortunately for me, in a few months, I got the surgery in April. By September, I was pretty much feeling and seeing the effects of what I have now. So it was a very quick, about 5.5 month, I guess, recovery process until seeing the progress of the results. So it was quick. You know, I'm healthy. I play sports a couple times a week, exercise multiple times a week as well. Eat pretty healthy, so I think that helped. But the doctor did a fantastic job. I mean, my hairline is, you know, I think is perfect and natural looking as well. So it's just a really good, you know, experience through and through, from finding the doctor and meeting with the doctor all the way through surgery day, after the surgery, and then, you know, even today. Just everything with Dr. Diep's been great. So to think back, through the hair loss and my, you know, a couple years back to today, it's just, I feel so much better, you know, not wearing hats as much, you know, don't mind getting the hair wet, can keep the hair short pretty much, even with FUE, style it however I want, longer, or as you see right now, short. And, you know, it's just been a great process. And, you know, did this ahead of getting married as well, so this summer looking forward to having some great wedding pictures as well, which is going to be great. We'll show well for the wedding, so the old lady will be happy with that. But
yeah, but you told me that you don't want the photo from
no
surgery.
photos from before surgery for that. I gotta look like stayed this young forever. So just, it's been a great experience with the doctor, just through and through. I couldn't, you know, if I need to come back, I'd certainly come back to the doctor, but I don't think that's gonna need to happen anytime soon. But you know, everything with Dr. Diep's just been great, and just thankful to have done it with him, and you know, to be here and have these results is just nothing short of fantastic. So I'm really pleased with everything. It's been fantastic.
Thank you. Let me clarify to the audience, when we do the FUE, there's no suture, there's no stitches, so, you know, and then that's one, and you heal fast by itself. For all my patients, I'm on call for them, so we provide printed cell phone on the front page, right?
Yep.
Yeah, and so when we went over verbally, and then the patient can have my cell phone now. Although I don't pick up the phone when I operate or when I exercise and all stuff, but if you text me or leave me a message, and then I will get back to you whenever I have a chance. And again, if you have any minor, you know, rare, but, you know, if a little infection, those can be treated with surgery, with medication, and if you do it early enough, then you can have a good result. Yep. And but again, thank you, Paul, for allowing me to show the audience what your full face is like. You know, a young, handsome guy. But sharing your story is to hopefully give the audience a glimpse of what's it like to go through surgery. It's a stressful, exciting, stressful, you know, and especially during the recovery period, you know, and it's scary for some people to have a little not perfect during the recovery period. Yep. But you will go through, just be patient, and then you were lucky enough to have it when you woke up one day on September or November.
Pretty much. It was like 5 months after I cut my hair shorter, and was fortunate to kind of look in the mirror and say, oh, it's back, here it is. So I felt, you know, from that point in September, I think, like, shaved 5 years back off my life, feel younger, and, you know, just feel great, and very pleased with the result. And, you know, to Dr. Diep's point too, you know, thinking you have an infection, you know, you can think everything through and overthink everything while you're going through the recovery process, but just take time and you'll get very good results. I think the doctor does just great work, and you see that here. So nothing to worry about. Nothing to worry about.
Hey, congratulations, Paul.
Thank you.
Getting married too.
Thanks.
Take care.